Hi, and welcome to the Aspen New Voices, Voices of Resilience podcast. I'm Rene Sparks. I'm a public health professional based in Cape Town with a foundation in nursing. I'm also an Aspen New Voices Fellow. I'm joined today by Taha Sabri, who will introduce himself as well as our awesome guest speaker. Over to you, Taha.
Thank you, Rene. Hello, ladies and gentlemen. Assalamu alaikum. My name is Taha Sabri. I'm a doctor working in mental health in Pakistan. I'm pleased to greet our guest today, Mr. Danjuma Adda, who's a Nigerian prince with a master's in public health. He's the executive director at the Center for Initiative and Development and Shagro Care Trust, as well as the president-elect of the World Hepatitis Alliance. Thank you for joining us, Danjuma. So, our first question for you, Danjuma, is that can you tell us why hepatitis? Like, why do you advocate for hepatitis, and why is it a topic so close to your heart?
Thank you, Rene, and thank you, Taha. So maybe just a little correction. I am the president now, not the president-elect. I was the president 2 years back. So I'm a president-elect, but I assumed the role of the president, which my term ends next year. So the whole thing started when I received this call, and this has been part of my story. And I got this call, and on the other end was my dad, and he told me one of the most shocking news, which up to today I haven't recovered from. And he told me your mom had passed on. And then I literally blanked out. And then what was the cause? He told me liver disease, but he's not sure. So 2 months after, because my mom was not in the country, she was transferred somewhere to receive treatment. When they brought back her corpse, I looked through her for the funeral. I looked through her records and I found hepatitis. And that made me to recall while growing up as a young person, because my mom was my best friend. We usually go to the hospital in those days when she had jaundice, and she had, the jaundice, the weakness of the body, and the doctors told us hepatitis. But the doctors then told us, no problem, everybody have hepatitis. It will go on its own. And of course, as a young person, we were ignorant, we had hopes in the hospitals, and we didn't know what it was. So I now kind of thought, this is like 15 years after the doctors had told us, no problem, hepatitis is a common problem, everyone had hepatitis, and this is not the same thing that has taken the life of my mom. And for me, I now decided I needed to know what that hepatitis was. And then apparently she had died of liver cancer, and the cause was hepatitis. That was 2007, 19th of August, 2007. And that was like 8 months after I got married. And then I decided to know what hepatitis was. And I also remembered that in December of 2004, I had met the lady who currently is my wife now, and we were to do some premarital test. So we went to do the test, and when I did my HIV, I was negative. I did hepatitis, and boom, I saw hepatitis B positive. So I walked in the hospital, and I now cast my mind back to when I had one needle stick injury, and with hepatitis, co-infected sample of HIV and hepatitis. I got the HIV prophylaxis, but there was nothing for hepatitis. So when my mom passed on, I saw liver cancer, hepatitis. Apparently, I'd forgotten about my own hepatitis B, because then we were told it's not a problem. Everybody has hepatitis and it will go on its own. So I made up my mind.
Was your diagnosis before your mother's death? Or?
2004. 2004. My mom passed in 2007. But between 2004 to 2005, I got married 2006. I never thought it was something very important for me to really know much about, because I was also told it's not a problem. Over 2 billion people had hepatitis. So you are likely going to resolve it. It's likely going to go. And 2007 now, my mom passed on, and that was like the icing on the cake. I said, no, I needed to know what this hepatitis was. And funny enough, my background was microbiology, virology, but I didn't know much about hepatitis. I worked in the hospital, a graduate, a public health person, but I never knew much about this deadly disease. You can imagine if someone who worked in that sector, a graduate, and didn't know about hepatitis. So that was like an eye-opener. I needed to do something about this disease. So I decided to do much more studies.
And
actually,
why do you think that was? Like, why do you think that the
probably lack of awareness, lack of information, and there's little visibility about hepatitis. And even when my mom died, the liver cancer was not so much attributed to hepatitis. It was just like one of the diagnoses of she was diagnosed with. But now, with what I know now, of course, it was ACC as a result of hepatitis B. So that pushed me now to know much about the disease and to start my charity, which I started back. I started my charity with the mindset that I needed to understand this. I needed to save lives. I needed I wanted people, I didn't want people to pass through the pains I passed through. Losing my mom at a very crucial moment in my life. My wife got married. My wife was pregnant with our first baby. My mom is the first grandchild. And then she was my best friend. She was my best friend. And that really moved me to start my charity organization with the desire to help lives, to save lives, to take away the pains that I pass through so that people don't pass through the same pains. And that motivated me to go into communities. I remember in those days, I get paid my salaries. I call other colleagues, laboratory scientists, nurses, some clinicians. Let's go and do hepatitis testing. We go to schools. We go on radio, great awareness. And 2009, 2010, I joined the World Hepatitis Alliance. So that is really the background to what I currently do. And today, I'm privileged to be the president of the World Hepatitis Alliance. See part of my inspiration, see part of the passion, the flame that was ignited in my heart those times to contribute towards eliminating hepatitis. And I'm not turning back, and I hope not to turn back. And I hope within my lifetime, I want to see that disease is eliminated.
Fantastic. Thank you very much. So it's deeply personal to you from not only yourself, but also from losing your mother to this.
Yeah.
So how difficult was it to actually be telling your story or sharing your story with living with hepatitis? And then what does the stigma and the support look like within the space?
Wow. There's a lot of stigma because hepatitis in my community, just like in most African communities, associated with a lot of things, with witchcraft, associated with social lifestyle. For example, is sexually transmittable.
And is it a particular variant or any variant from A?
Hepatitis B in particular and C, which of course are the two ones that cause the public health importance. So now again, because of the lack of awareness about hepatitis, people ascribe it to, you could get it through casual contact, you could get it through sweating, you could get it through handshake. And then the belief out there is that it's a death sentence. You get hepatitis, you're just going to die. So because of that fear of you're going to get hepatitis and you will die, and you just get it through, in fact, people term it as contagious disease. So it's contagious. You get it through casual contact, handshake. So anybody with hepatitis is seen as the devil that needs not to be close to you anymore. In fact, families keep people that have hepatitis, separate them from separate rooms, keep them in separate rooms, give them separate cups, separate spoons, and then don't even come into casual contact of handshake because it is assumed. Yeah, it is assumed that you get it, you're going to die suddenly. And because of time, so they look at as a witchcraft, they ascribe it to so many things. So the myths and misconceptions have really driven the stigmatization. And again, because hepatitis B apparently has no cure, people even have lost jobs. I know people that have been denied visas because they attempt to have a disease that they will die suddenly from. People in certain countries today don't take on migrants, or don't take on people with hepatitis B in Asia. They don't, in some countries in Asia, not all anyway, will not accept visa applications if you have hepatitis B. Some jobs in Nigeria, military or some paramilitary, or even some institutions will not even accept if you have hepatitis B. And that is really misunderstanding about what hepatitis is all about, right? So I, as an individual, my first stigma started when I had to disclose my status to my then in-laws. And then I had to tell my wife to be then and my wife that I had a disease that she might likely get through sexual contact with me, and she might likely get, and then she might die suddenly. So both of us, so why would she marry a person, a man, a gentleman that will die because of, they will die suddenly because of hepatitis B? So that was a big battle. Should I disclose? Should I not disclose? Should I just keep quiet? Should we disclose to the in-laws? But I'm happy that I was bold enough, told her, and she got tested. She was negative. She got vaccinated. And this is like 18 years after. We're happy with our 5 beautiful kids who are all vaccinated. And then we keep telling people this, and I'm happy that with more information, with more awareness, the stigma level is reducing, but it's still very huge because organizations will run testing for workers, and when they're positive, they fire them. So, but it's really still a big battle that we hope programs like this will maybe possibly help us to mitigate the challenge of stigmatization.
So do you feel that like being diagnosed, I think it's been almost like 17 years since you were diagnosed with
like 20 years.
20 years.
Yeah.
And you've been taking treatment and thing is you didn't die suddenly, yeah? So do you use that as an example, your own life, to destigmatize
Yes.
the issue and to help others see that it is not a death sentence as perhaps it used to be before treatment was accessible?
Yeah, so I've used my story, and I hope this space and that's why when Rene told me about this, I have to jump into it despite my schedules. But I use my story to tell people it's not a death sentence. The assumptions, the myths and misconceptions people have is not what really it is. And then again, the language of hepatitis. Sometimes healthcare workers and clinicians also help to fuel the stigma. For example, hepatitis B. And they keep telling it's difficult, it's complex, it's very difficult to treat. Yes, it is. It's a very stubborn virus. We know it is stubborn. For now, there's no cure, but we're hoping to have the functional cure. So I have always used my story to tell people, to create that safe space, to tell people it's not what you assumed. There's still hope, and early detection saves lives. And then understanding your status, you reduce some risky lifestyles. If you take maybe you take a lot of herbal medication. And again, in Africa, we see lifestyles as driving factors towards people, progressing faster with chronic hepatitis B to liver cancer. For example, alcohol intake, herbal medications. You have a disease that is, the virus is, the liver is affected. You don't want to add more toxins to the liver. You don't want to live more risky lifestyles. And things like aflatoxin, right? These are common things, sub-Saharan Africa, in meals, in food, people take casually. But studies have shown that these are things that drive people that have hepatitis B to more progress faster to liver cancer. So, but then I've used my space to tell people that it's not what people think. There's still hope. If you detect early, you make adjustments to your lifestyle, you start treatment early. You could live as productive. And of course, every human being is going to test death, right? But it should be of any other thing and not necessarily of liver cancer.
I think privileged on one end to be working with the National Department of Health here in South Africa. And we are about to roll out hepatitis screening throughout. So we've just updated our registers and everything. But it's reminding me of working within a civil society space where the workers, the peers, so we've got different programs that are peer-led, and those peers and those counselors are never vaccinated. So how do we get to a point where we have all healthcare workers, irrespective, or actually anyone who wants it and who's eligible or who can have it, to get vaccinated? Where do we start with that type of advocacy? Because I know when we wanted in some of the NGOs to get our healthcare workers vaccinated, we then had an issue with access to vaccine. So just how do we even bridge those gaps? It's like not even the screening, but just the vaccination bit, Yeah.
Rene, you're touching on a topic that we have been battling with for so many years. Let me start with the fact that hepatitis B, being a leading cause of liver cancer, as you rightly said, is completely preventable with a safe, efficacious vaccine. So we have the solution to protect lives. We have the solution to protect babies, for example, because hepatitis B could be transmitted from the mother to child, vertical transmission. We have the opportunity to prevent new infections, to have a generation of kids and babies that will be free from hepatitis B. But a vaccine that costs 20 cents is not available or affordable. As a matter of fact, when COVID came up, Gavi, the major push for vaccines, stalled, paused the support for vaccines. But I'm super happy that with strong advocacy, we've been able to talk to them, and we are hoping the board meeting is going to see this June. And I hope whoever is listening and hearing this and have the ears of the board members of Gavi, we're asking and pleading Gavi for the sake of unborn children and children born all over, please unpause the hepatitis B birth dose vaccine. 20-cent vaccine that could save lives, 20 cents, but it was paused. So many countries in Africa are no longer providing birth dose vaccine, Rene. This is horrible. So children are being born with the risk of getting infected vertically with hepatitis B. And about 25% of these children will develop liver cancer. At the productive age of their lives, when they have been invested into, they're supposed to come back after studying, after contributing to the society, boom, they have liver cancer. That could be averted. Africa today are seeing the data in Africa today. Sorry, I'm going back telling you this so that to tell you what the issues are. Yep. We are having young people, 2025 in Africa now, dying of HCC, liver cancer. And most of this is attributable to suboptimal vaccinations. For example, my first son is 15 years. Countries that started birth dose started about 14, 15 years ago. So majority of young adolescents, older adolescents that missed out vaccines, 18, 19, 20 years, most likely might be living with hepatitis B. And these are the cohort of young people that will likely develop liver cancer. So it is really appalling that hepatitis B birth dose vaccine is not even available to babies. Now, coming to healthcare workers who are at risk population because of the risk of exposure to hepatitis B, many national guidelines recommend vaccination to at-risk groups, either key populations or healthcare workers, but the vaccines are not mostly available. So the question is why? So this is the reason. This is a push to governments to prioritize this because there's return on investment. You save lives, you save productive lives of the health workers. You save, a lot from the economy. There's a lot of return on investment in saving, in giving healthcare workers vaccinations. But we have challenges of the availability of these vaccines. So even for the children, for birth dose, there's a lot of challenge. Not to talk of huge, for example, China vaccinated so many, and that's why they're reaping the benefit now. They've averted new infections, right? So, but sub-Saharan Africa, we're seeing young people developing liver cancer because we failed in investing in birth dose vaccines about 15, 16 years ago. And if today we don't invest in these vaccinations, we are likely going to churn out young people that will have liver cancer 20, 25 years from now. And that is really avoidable. This is something that we could avert if only 20-cent vaccine, which costs little to nothing, could just save the lives of the productive years of the that should be able to take up the economies of Africa and the other LMICs. So it is something we all need to add our voices and say we need to make these vaccines available. And currently now it is advisable.
Danjuma, just to ask there, so the cost is almost nothing, right?
Right.
So what do you think is preventing this from happening? What are, in your opinion, what are some factors which are preventing African countries or other low-income countries from adequately rolling out hepatitis vaccination programs?
Maybe one of the reasons why hepatitis have really been like the neglected child in the home, you know, in the home we have siblings. We do apology to my colleagues in the HIV space, but the HIV space have really had the billions of dollars.
That's true.
So
it's true.
Like it's like the child in the home that wears the Gucci, that wears all the branded clothes. But hepatitis is like that small babe, the child who is stunted, is not growing, is neglected. But same or similar mode of transmission. Sexually transmission, vertical transmission, on-screen blood, everything. But why is there no interest in hepatitis?
And even a higher risk of contracting, right? Of transmission. And even a higher risk of transmission.
Higher is 50 to 100 times. 50 to 100 times more infectious than HIV. Kills 1.1 million people every year. Almost every 30 seconds, one person will die of this disease, right? 1.1 million people. These are fathers, mothers, uncles, aunts, children, people, human beings. The leading cause of liver cancer. But probably because we have not seen one or two big political leaders in Africa speaking for hepatitis. We only have the government of Egypt that prioritize hepatitis. But maybe it took the George Bush to speak, and PEPFAR rolled out money for HIV. So maybe we need that political push in Africa. Maybe we need the voices to speak to political leaders. Maybe the Dangote of Nigeria or the Otedola or the rich people in Africa need to maybe just have the interest to do this. So political leadership and voice, I think, might change the narrative about hepatitis in this region. Our leaders need to do more beyond just going to African Union or WHO's World Health Assembly site meetings.
And how do we create that political will, Danjuma? Like I think it makes complete sense that there's a lack of political will, and other chronic diseases like HIV are getting far more focus.
There is a political will. We're lacking political action.
Okay.
Many African countries have guidelines, have strategic documents, but they're not funded. They have not prioritized and seen the need to invest in hepatitis as development, as security, as roadwork, as infrastructure.
Do you feel it's also to do with the priorities of the global north?
It's priority. Yes, it's poor prioritization in financing. It's not even included in insurance in most countries. People still do out of pocket. And again, each time we speak to pharmaceutical companies and let's say vaccine companies, they will tell you that African leaders are the ones putting bottlenecks for them because there are multiple taxations and registrations in African countries for, let's say, pharma companies, right? So we need to harmonize registrations or taxations for some of these companies, because by the time they pay multiple, after 3 years, they need to renew their license. They will register in Nigeria. They'll go register in South Africa, in Ghana. Ghana, that is just West African country. They may need to register again in Ghana. And at the end of it all, they transfer that cost to the patient.
Yeah.
And yet, governments in most Africa are not even standing in between the patient and these companies, right? So it's out of pocket, people are left on their own, and
no regulation, exploitation.
Exactly. People that are living below $1, you're asking them to pay for $200 to get hepatitis C treatment is crazy. They'll prioritize feeding. They'll prioritize, feed food for their homes. They'll prioritize education of their kids. They'll prioritize security. So these are some of the issues we have.
I just wanted to touch on, so I know when I met you last year, when we met, with the fellows in Kenya, you were speaking about, how can we go about and screen or test for hepatitis, even in the spaces that we are. So you were speaking to individual fellows. And I was left with, okay, so if we screen and test, then what? What is the situation in terms of access to treatment or access to care, let's put it that way, thereafter? So I think I'm looking at it now in our context because we are screening, and I'm trying to understand what network or referral pathways exist within the Global South. Do we actually have the funding and the infrastructure to do justice to the care and treatment aspect of hepatitis as well?
Thank you so much, Rene. And I think the major barrier about hepatitis have to be the diagnosis and the testing, right? Because about 95% of people with chronically infected are even unaware that they are living with a disease that has a potential to cause liver cancer. So the major gap is people need to be screened, and we need near point of care.
Danjuma, we can absolutely hear your passion. I mean, you are oozing all of this, and it's fantastic.
Probably on Egypt.
So Danjuma, it's clear, and thank you so much for educating us. It's clear it's such a critical issue, and there's so little attention focused towards it. So what advice would you like to give to other like health advocates, activists who are working on hepatitis prevention in their countries? What lessons have you learned which can perhaps help others in the same boat as you?
What lesson I've learned is that we should leverage other opportunities. For example, we're leveraging opportunities of cancer network, telling them hepatitis B is the leading cause of liver cancer. So that is bringing us to work together. We're leveraging opportunity from maternal and child health to say, hey, you guys in maternal and child health, hepatitis B has a vertical transmission, so we have to work together. We're leveraging sexual reproductive health to say, hey, it is a sexual reproductive health issue, right? Women are deprived the right to be tested in antenatal. Young people need to be screened, right? So let's leverage every opportunity, look at what are the lowest hanging fruits, and every space, whatever there is a space to bring hepatitis, to bring the narrative, to share the story, and then to advocate. I'm so happy, and I hope people would leverage all those opportunities. And let's look at the people-centered approach. Let's look at how do we really look at the human being, right? And then the wholeness, the whole being, and bring every condition so that we improve the lives of the people we have. And it is my hope that within my lifetime, that is what I hope, should be able to contribute to a elimination of hepatitis. And I hope we should add our voices. And I'm so happy for you guys for giving me this platform to share this. And I hope we will have more opportunities to share advocacy stories and advocacy to just increase and amplify the voice of the neglected child, which is viral hepatitis.